Hi, and welcome to our short video on women and depression. 1 in 6 Americans will suffer from depression at some point in their life. Major depressive disorder is the leading cause of disabilities in the U.S. for people between the ages of 15 and 44. And women are twice as likely as men to suffer from depression. If you think you're struggling with depression, you are clearly not alone. So what is depression? We all have bad days. Things aren't going well. We're feeling down, blue, in the dumps. Want to just stay in bed, pull the covers over our head, and just wish the world would go away. When we're thinking about major depression, it's when those symptoms are persistent, when they're sticking around for at least a couple of weeks, and they're starting to interfere with your life. Some of the symptoms of depression include changes in your appetite, your weight, changes in your sleeping patterns, sleeping too much or too little, feeling hopeless, having a really hard time enjoying the things that used to make you happy, and having a struggle just getting through your daily routine. You'll feel physically run down, and you can have feelings of intense guilt or worthlessness, and possibly even thoughts of death. And as I mentioned, women are twice as likely to experience this as men are. So why is this? There are a couple of theories. First, hormonal. We are different than men. Men and women are different biologically. Our bodies are different, our hormones are different, and the way we respond to stress is different. We produce more stress hormones, and we have a harder time calming down that fight or flight response than men do. And there are also social and cultural differences, things that affect women more prevalently than they do men. 70% of single-family households are headed by the mom. Women are far more likely than men to live below the poverty line. And women are the victim in 92% of domestic violence incidents, and 1 in 6 women will experience a sexual assault at some time in their life. These chronic stressors can contribute to developing major depression. So if you think you are depressed, what can you do about it? The first thing you can do is talk to someone. Talk to your doctor. And just as a side note, gynecologists are very knowledgeable about women and depression, especially about the hormonal changes that can occur around your period, and they can prescribe antidepressants if necessary. Talk to your friends, talk to your spiritual advisor, anyone that you feel comfortable with. There are nationwide hotlines that you can call if you're feeling in crisis. And since you're online right now, just a quick search can hook you up with some local services as well. Treatment for depression generally consists of therapy, medication, or a combination of the both. And treatment works. If you've tried medications in the past and you haven't been successful with it, please try again. There's ongoing research to develop new medications, new therapies. So there's new things out there, and there's more on the horizon. So if this sounds like what you're going through, you are not alone, and it's not your fault. Abraham Lincoln suffered from depression, so please talk to someone and take those first steps in getting better. Thanks.